So can you tell me your name and a little bit about your background?
Yes, I'm Amy Killen, and I'm a medical doctor. I spent about 10 years doing emergency medicine, so my background's actually ER. And then about 5 years ago, started kind of deciding that I was interested in doing other types of medicine. So I started becoming interested in anti-aging and preventative medicine and integrative medicine, regenerative medicine, all these kind of other types of medicine that you don't learn about in medical school. So I kind of started getting into that and learning about that, and then I've been doing that full time for the last 5 years.
So fascinating. How does it work with when we look at our health and we look at our well-being and the struggles that we have with all the processed foods and all of the things out there that are just increasing our insulin levels? How do you sort of view the foods that we're eating, and what would your recommendations be for our overall best health?
So I always, when I have patients, because I in my practice I have an integrated medical practice, and we do all kinds of integrated medicine, and nutrition is a big part of our practice. And I have a lot of patients who come in and they're like, I'm eating healthy and I can't lose weight and I'm exercising, and they're so frustrated. And then we talk about, like, what are you actually eating? And they're having like some bread for breakfast, and they're having like a bowl of oatmeal. They're eating all of these things that are essentially just sugar. And so we have this conversation about, like, you're actually eating sugar, things that get made into sugar, whether it's directly or indirectly. And all of these things are obviously they're horrible for you. That affects all of your hormones, like insulin, and then you get this whole sort of symphony of things you don't want. So I always recommend a low carbohydrate diet, a keto diet, a paleo diet, depends on the person, but something where you're really keeping those simple carbs really, really low.
So when you talk about the insulin levels and this whole symphony of chaos that occurs,
Yes.
What else happens with the hormones?
So, a lot of things happen. So, one thing with the insulin, which not everyone understands, but, when you eat sugar or carbohydrates of any sort, you get the spike, in your glucose, which goes up and down, and you get these big ups and downs, these big swings, which is why you get super hungry sometimes because your levels drop really low. So that's a big deal, and that can increase your cortisol levels, just those ups and downs in your sugar. And cortisol is your stress hormone. So when you start having high levels of cortisol, then that can affect all of your other hormones. It can affect how your testosterone works in your body, how your thyroid works, how your estrogen works. And then, of course, you have your insulin, which instead of going up and then coming back down like it's supposed to, the insulin will then go up and just stay up. And that's when you get the insulin resistance, which is basically your body, it's saying, hey, this insulin's not working anymore. So we're going to stop listening to it. And that's when you get really big problems with obesity and weight gain, because insulin is like fat cell fertilizer. It's telling your fat cells, keep storing that fat. We're going to need it later. So if you have high insulin levels, then no matter what you're doing else, exercising, whatever, you're not going to lose weight. And that's a huge key for everyone.
So with these high insulin levels, what else can we do? Like, obviously, when we stop eating or we slow down on eating these simple carbs and cut them out of our diet, what else can we do? Because there's so many cravings, right, that come with the glucose.
Yeah. So I always tell patients that if you're going to eat any sugars or any simple carbohydrates, you always want to pair it with a good fat and a protein, because those things will help to decrease the rate of absorption of your sugar and decrease that glycemic load, so you don't have that huge spike in glucose and sugar in your blood, and you don't have this huge spike in insulin. So that's one thing, pairing things correctly and not just having like a bowl of a sugar, essentially.
Right.
And then as people start to decrease the amount of these simple carbohydrates that they're eating and really replace them with fats and also proteins, then I find that the cravings, they go away. Like, and that happened to me too. Like, I just all of a sudden I was like, oh, I'm actually not hungry, because you're getting enough calories from the fats. And so it takes a few days for that to happen. But I find that if you get people off of the sugar and off of the simple carbohydrates, then and replace it with fat, then all of a sudden, they're losing weight, they're feeling better, and they actually are not hungry. I feel like even within a few weeks, when people start seeing that they're feeling better, they're thinking better, they don't feel as bloated. There's like a lot of sort of gastro, intestinal kinds of problems that tend to go away in people when they start giving up a lot of the sugars and simple carbohydrates. It depends on the person. I mean, some people have, intolerances, like gluten intolerances, or certainly allergies as well, where they're actually getting this gut inflammation, like the intestines are actually getting angry at this food, and they're kind of causing this this reaction that the whole body starts to get inflamed. And so some people, it's just the gluten. Some people, it's sugar. I mean, sugar is inflammatory to pretty much everyone, but some people have more of a reaction than others. And then some people, it can be other grains as well, but basically when you get rid of those things, especially if you have a sensitivity to it, then all of a sudden the cells that line the intestinal tract, they start to become healthier. The gaps between the cells start to go back together, so you don't have all of this autoimmunity stuff happening, and people just start to feel better. You don't, the bloating goes away, the cramping, the kind of things that people kind of get used to having. But then all of a sudden you cut out the bad foods and they're like, oh, I don't actually have to have those bad feelings.
It's so true, right? Like how many of us walk around with that feeling of being bloated and not necessarily connecting the dots.
You just think that's how it is. Like, oh,
Yeah.
well, this is how I feel some days. And that for me personally, when I started doing a keto diet, and I just realized, oh my gosh, I haven't had like that, my stomach pain in weeks. And once I slip and have a treat or something, and it comes back, and it's a good reminder that my body's not happy with those things.
So much of the research is showing that when you're fasting after day 3 or 4, we're hearing that a lot of people are speaking about how stem cells are being activated during that time. And as a practitioner and a researcher around stem cells, you're working with them every day. Can you tell us a little bit about what's going on in the field of stem cells?
Yeah, there's a lot. In my practice, we use stem cells for a couple of different things. We use them for musculoskeletal pain, so for treating, knee pain, back pain, disc pain, anywhere that you have pain, you can essentially inject stem cells, which you can get from either bone marrow or from your own fat. Those are the two kind of main ways that we get stem cells from patients. And then I also use stem cells for other applications, like in aesthetics, to try to improve skin health and regenerate skin, for hair, for try to improve hair and hair loss, and in sexual optimizations to try to improve blood flow and nerve regeneration in sexual organs in men and women. But the field is huge. I mean, we have so many different sources of stem cells. We have, you can get them from the patient, you can get them from umbilical cells or placental cells, or there's all these different types of stem cells. And of course, there's thousands of studies going on, so we learn more things every day.
Where do you think the research is going to go, and how long have stem cells been researched, and where will it be going?
Oh, it's been decades that they've been researched. Traditionally they talked about embryonic stem cells, which are the ones that are very controversial because you have to get them from an embryo, which is not what we do. Now we talk more about, at least in my field, we talk more about adult stem cells, which is really, stem cells, not necessarily an adult, but just a person that you can use that can still be used to regenerate all different types of tissue. Because the way that stem cells work is they are able to replicate themselves and regenerate themselves. So if you could put them somewhere else in your body where you have some kind of problem, then there's the potential for those stem cells to essentially activate and lead to a regeneration of that tissue. So that's kind of where a lot of the research right now is being kind of aimed at these adult stem cells that we can take from the patient themselves. You can culture them and expand them and use them over and over again, or you can just do a single day procedure with them.
So when you're culturing these stem cells, you're just continuing to grow them out for how long? Like, what is the amount of stem cells that you can
That's a good question. So they have a certain number of passes that they can
Mm-hmm.
that they'll do. I don't even know the number, but basically they have a set number of passes. So they culture it, expand it a certain amount, and those cells then can be used. You can get maybe 20 or so applications of those cells. So
Wow.
later on, 5 years from now, all of a sudden you hurt your back in a car wreck and it's not getting better. If you have already cultured your cells and they're somewhere in a cryo chamber, they can send them to you, and then they can just be injected into that area that's hurting without having to go through like the liposuction or the bone marrow aspiration or the different procedures to get the stem cells. So that's the benefit. And if you culture when you're younger, then you have nice young, super happy stem cells. Versus if you wait until you're a lot older, then the stem cells are not usually quite as active or as plentiful.
It's incredible. Thank you so much for teaching us all about stem cells and then this connection with the nitric oxide. And it's a really fascinating area, and I can't wait to learn more from you.
Yeah, you're welcome. Thank you. It's been fun.